So now we are ready for the second procedure, and I'd like to present you my lovely patient Marie from Romania. She's 37 years old and she's a fitness trainer, and you can appreciate a very athletic body. Actually, Marie is complaining a little bit of some degree of hip dips, and as I told you before, we appreciate the hip dips in the two positions, front and back. So you can appreciate on this frontal view the three levels of the hips: upper, central and lower, and the hip dips really correspond to this central zone and also to the great trochanter. So now I like Marie to turn 180 degrees, and we can appreciate now these hip dips from the back view. Again here the upper hip, the central hip or hip dips, and here the lower hip. So we are going to focus our treatment in this central hip or hip dips or hip depression. Now we are ready to start the markings. I will use first of all a black marker to place some anatomical landmarks. The first one is the horizontal line, which is corresponding to the half of the intergluteal cleft. And I'm going to the front. Why this line is important? Because it gives the maximal projection of the hips. And I like also to mention that it should correspond to the pubis on the front. So this is a first line, and the second line will be vertical, the half of the thigh and the butt. Finally, I will place a third line corresponding to the great trochanter. Here you have the great trochanter, and we are able to draw this line. You can appreciate the difference between the medial butt, lateral butt, and really the hip region. On this view, you can see that she has a good projection. She doesn't complain at all from a butt projection, but on the back view, she's complaining of this mild degree of hip dips. So now I'm going to use the blue marker for the injection zone. Actually, what we want to do, we want to go from this point to this point. We want to bridge over these 2 points to be able to feel this depression and to have a homogeneous and single contour on the hips. I'm going to mark this zone. We see here that it starts to deepen at this level, so it will be 1. At this level also in the lower part. We want to have an effect from the front, so we will go quite anterior. I call that anterior hip expansion. And finally, from the posterior part, we will go somewhere a little bit in the lateral butt. So now I'm ready to mark this zone. As you can see, it's mainly on the hips, but a little bit also in the lateral butts. This is the zone of injection of HYAcorp MLF2 in the hips, and you can appreciate again that we will go from this point to this point. It's very important to appreciate these two convexity and in between this depression. Finally, I'm going to use a red marker now to place the entry point of the cannula, which will allow to inject HYAcorp MLF2. I like to use always 2 entry points to be able to crisscross my injection. One entry point will be here, posterior, and one entry point will be here, superior. This way, we can place our thread this way, and the other one will be perpendicular. So I like to summarize this treatment of hip dip filler. We will focus on this blue area, going quite anterior because we want to be able to see the result also from the front. And we will stop here, close to the lateral butt, because she's not complaining of the butt projection. And finally, on the vertical aspect, we will go from this point to really feel the depression. We finished the first side, and now we are going to mark the second side. We just finished the markings on the second side, and you can appreciate that they are not exactly the same. It's very common because the hip dips are very often asymmetrical. But the concepts are the same. We have here the upper hip, here the lower hip, and in between this depression that you can appreciate more in the back view. From this point to this point, there is this depression. And regarding the entry point, we will use again two, one medial for horizontal thread and one upper for more vertical thread, and we were able to cross our injection. So we are ready for the procedure. Let's go. So we are ready now for the procedure of the second patient. We have here the injection zone and the two entry hole for the cannula. I'm going to start by the local anesthesia of the entry point with xylocaine adrenaline and a very small needle, 30 gauge. Now we take the 18 gauge needle and we open the hole by this lateral movement. And we do the same on this one. The injection of HYAcorp MLF2. It's very important to pinch strongly because, as you know, in the hip dips, we have less capacity of expansion because the superficial fascia is stuck to the deep fascia. So, good pinch and deep injection. Okay, let me go here. We need to go quite anterior. This is what we call the anterior hip expansion, to be able also to correct the hip dips, not only from the back, but also from the front. Now we are going to change the entry point. So now we are going to change the entry hole. I'm going to use this upper approach. And this way I can inject now perpendicular to my previous injection, both deep like this, so we are ready now to inject the second side, the left side. Again, you see here the markings, the injection zone and the two entry hole. Let's start with the anesthesia of the entry hole. Always the same, 30 gauge needle, xylocaine, lidocaine with adrenaline. Okay. 18 gauge needle. Lateral movement to open the dermis. Then additional anesthesia with a 22 gauge cannula. So again, same technique. We will use these two entry points with perpendicular injection and two layers of injection, deep and superficial. Deep and superficial. So we are going to start the injection by this medial port. We pinch. This way we have the access to the deep fat. So this is first of all a deep injection. And then we go a little bit more superficial now by not pinching but stretching the skin. So I'm more parallel to the skin surface. Not really subdermal, like few millimeters underneath the skin. Okay, I will take another one, a fourth syringe. And now I will change my entry point. I will go here. Number 6. And again, we go very anterior to be able to expand the hips anteriorly. I will take a 7 syringe. So we just ask the patient to stand up for the final touch-up. Why? Because we are able to see much better. Actually, if you look, for example, on the right side, we are able to see that just in between the two entry points, there is a little flatness. And also here, below our injection, some depression. So these are transition zone, and I would like to complete a little bit the treatment in these two zones. So one will be here, and one will be here. Let's do the same on the other side. What do we see? Same story. We have a little depression here. Actually, it was not the treatment plan, focus on the hip dips, but as I always say, when we do a zone aesthetic unit, then it impacts the surrounding ones. So now it's obvious that we need to make a little complement here, and also at this level. Okay. So you can see here the plan for the touch-up. On the two sides, we will inject the transition zone higher and lower to the injection area. And same here. This zone and this zone to make smooth transition zone. We will perform this injection in this position to be even more precise. So I like now my nurse to come. And we are going to start with this side, for example. I will do this zone from this entry port. So let's start with this first zone from this entry point. My cannula is here. Same, deep, Okay, and we are going to complete here with half syringe in this zone. Okay, good. So we are now on the second side, the left side, and we just took a new syringe with a new cannula. I will treat this zone in the lateral butt from this entry point, and this zone from this one. Let's start with this zone. Same story, I will pinch for a deep injection, and I will okay. Sorry, dear. So we make a massage, and you see this is a good part of this product. It's very easy to mold. And we finish the treatment with this final touch-up. With half syringe to make a nice and smooth transition zone. Okay, so we finish the treatment with 8 syringe and a half on each side, so 85 cc each side. And now we will clean and we will show you the final result. So we just completed the treatment of this patient with a hip deep filler, and now you are able to see from the waist to the thigh a homogeneous curve without any depression here at the level of the hips, and same here from the waist to the thigh, a single and homogeneous curve. On the side a little bit, you can see, you can appreciate this very nice roundness and fullness, which is much more feminine than before, because the hip dips always refer to a more athletic but also masculine look. Thank you for your attention, and we will show you the result.
I'm really happy with the way my body looks, but the only thing that really bothers me is my hip dips. Every time I plan to wear a fitted dress or even a beach wear, I don't feel comfortable with the way my hips stand out. So since this is taking a lot of my confidence, I decided it was better to change it. So I started looking for ways to correct my hip dips, and initially I tried exercise to minimize it, but didn't work for me. So another option I discovered to fix my hip dips with surgery. I considered it, but I was not convinced with the possible complication and the length downtime of researching. Also, my doctor informed me that I don't have enough fat to carry out liposuction anyway, so when my doctor suggested me body filler for my hip dips, I was quite interested. I could get my hip dips corrected immediately, and I used hyaluronic acid, which is a natural substance, so I knew that the risks were lower. The procedure is also short and it's relatively minimal, so I just felt more convenient for me that getting surgery done. This is why I decided to go ahead with the treatment. The treatment was not painful, I barely felt anything. It was honestly really quick, so I feel much better now that I got the procedure. I can confidently wear wherever I want and nothing is holding me back anymore.